You're listening to RPEC on Air, a podcast produced by the Retired Public Employees Council of Washington. I'm your host, Alyssa Brady, and today I'm joined by Emmett Mills, our Government Affairs Coordinator. Hi, Emmett.
Hi, Alyssa. Thank you for having me on the show. It's an honor. For a very long time, I have been excited to participate in the RPEC on Air podcast, and I'm really happy to have that opportunity today.
You're welcome. And just as a disclaimer, everything you say is being recorded and can and will be held against you in a court of law.
Okay.
So
well,
I tell that to just you.
I've been a big fan of this podcast for a very long time. I should also mention that.
Thanks.
Yeah.
I appreciate that.
Yeah. Ever since the first episode was recorded earlier
last week.
Last week.
Yeah.
Okay. I've been an avid listener.
Yes. Yeah. We are early on in the process, but I'm glad to already have you. Might be our first fan. I don't know.
I hope I'm not our last fan. I'll say that.
So, Emmett, would you like to share with us a little bit about your role as Government Affairs Coordinator?
So in my role as Government Affairs Coordinator, I'm a registered lobbyist, and so I work with the state legislature to communicate and advance RPEC's legislative priorities. And I also work closely with our legislative committee to help develop those priorities. I also work with our political action committee to help them make endorsements and campaign contributions in races for state legislature and statewide office. And so all of those activities together push our advocacy forward.
Cool. So today we're going to be talking about the 2024 legislative session and giving a recap now that session is over, ended in early March. So Emmett, what were some of the key issues that RPEC sought to address leading up to the 2024 legislative session?
Yeah, so there were really three issues that kind of rose to the forefront last interim. The first issue is something that we have been working on really since 2011. Retirees in the PERS 1 and TERS 1 retirement systems are the only retired public employees whose pensions are managed by the Department of Retirement Systems who don't receive automatic ongoing COLAs. That would be because in 2011, the state legislature took away the uniform COLA, which was the automatic annual COLA that those retirees received, to help address a revenue shortage that the legislature was facing. And so a lot of other things were cut at that time too, and most of those other things have been restored. An annual automatic ongoing Plan 1 COLA has not yet been restored. And so RPEC has been really instrumental in getting now 5 bills passed that provide one-time single increases to those retirees' pensions. So we helped pass those bills in 2018, 2020, 2022, 2023, and then, spoiler alert, we passed another one this session. So going into the session, getting another one-time COLA for those retirees was really a key goal. But ultimately, our goal for 2025, headed into this last session, was to restore an ongoing automatic COLA as retirees. And the reason that we were pushing for that next year and not this year was because a bill that the legislature passed last year requires the Select Committee on Pension Policy to study and recommend an ongoing COLA proposal by the end of this calendar year, essentially. So next year, the legislature is going to have a proposal before them to restore an ongoing COLA, and next year is going to be our opportunity. So we needed another one-time COLA this year to hold our members over until hopefully 2025 when we're able to restore an ongoing COLA. Another issue that our members all across the state have been experiencing is increasing monthly premiums in the Public Employees Benefits Board plan. So retirees, folks who retired from state employment and some local government employment are eligible to get health insurance benefits from the Public Employees Benefits Board. And the most popular plan in the PEB portfolio is Uniform Medical Plan Classic Medicare. And we've seen premiums for this plan just increase dramatically over the last 4 or 5 years, and it is unsustainable, it is getting unaffordable, and people are being forced off the plan. Now, our members really value that plan because it's the only government self-insured plan offered through PEB, and so we needed to figure out how we could address rising premium costs in that plan.
Yeah, I was reading just in the last 2 years, was it that premiums went up 46%? Is that right?
That sounds right to me, yeah. And so, the plan wasn't cheap to start with, but there's a subsidy that the state provides to these PEB plans, and that subsidy is 50% of the plan premium not to exceed $183 per month. And that $183 cap was essentially first set in, I believe, 2009. And it has not gone up since then. It was actually another thing that got reduced down to $150 in 2011 during the budget cuts, and we've been able to pass 2 bills to get it back up to $183. But $183 is exactly where it was, in 2008, and healthcare costs have increased so much since then. Mm-hmm. And so essentially each year when these UMP premiums are going up, the state's contribution, the state subsidy, is not going up because it hit that $183 cap years and years ago. And so retirees are entirely responsible for bearing the burden of those costs. So looking at adjusting that $183 cap was another thing that was really important heading into this session. And then there's one other thing that was also really important. And this is a little bit complicated, but it also has to do with retirees who get their health insurance through the Public Employees Benefits Board, or PEB. And it has to do with pension prorating in the month that a retiree passes away. So under current Department of Retirement Systems policy, when a retiree passes away, their pension is prorated based on the day of the month that they pass away. And that process of pension prorating interrupts a process that is followed by many retirees who get their health insurance through PEB. So most of these retirees elect to have their premiums automatically deducted from their pension each month, and so they don't have to worry about it. Unfortunately, due to pension prorating, when a retiree passes away, that automatic premium payment is interrupted and it doesn't go through. Then it's up to the healthcare authority to reach out and contact the survivors of that retiree and make sure that they pay the health insurance premium. If they don't do that, and some of them don't because they are dealing with who knows what after losing a loved one, if they're not able to do that, then the retiree will lose their supplemental health insurance in the month that they pass away. And so massive end-of-life medical care expenses can be passed along to the survivors of the retiree.
So essentially their health care, their medical expenses were all out of pocket. They weren't covered by their health insurance at that time, and those expenses fall onto the survivors.
Well, essentially, and it has to do with when the premiums are collected. So, so essentially, if the premium is not paid, then the health insurance lapses for that month, and expenses that would have been covered by the health insurance are not covered, and that passed along to the family members.
Yeah.
And so we also wanted to address that issue, which was, kind of elevated by the Select Committee on Pension Policy during the last interim. And so the COLA, the rising health insurance costs, and retirees losing their health insurance benefits the month that they pass away were the 3 issues that were most important to us heading into the session.
Wow. Could you tell us about some of the work that RPEC engaged in during the interim to prepare for this legislative session?
Yeah, so the work that happens in the interim is actually in many ways a lot more important than the work that actually happens during the legislative session. So it's during the interim that the groundwork kind of gets laid for the session. Legislators have way more time when the legislature's not in session. They have time to meet with us, they have time to meet with our members, and they really have time to sit down and build relationships. And so their groundwork is going to determine what can move forward in the session. So our members all around the state invited legislators to visit their chapters. And our members talked about these priorities, these things that we wanted to see the legislature address, and really educated them on these issues that are impacting them. And that really goes a long way because, staff can meet and our leaders can meet with legislators, but we don't vote in their legislative districts more often than not. And so having a request for action come from a constituent is really a lot more powerful because, if a legislator comes through for us and is on our side, that constituent is going to notice. They're going to reward them likely with the vote, and they're going to tell all their neighbors that this legislator is responsive and doing a great job for their constituents. And so, there's really nothing that can replace those, that kind of grassroots advocacy that we see our members do a really great job of all over the state.
Yeah. Good work, everybody.
I'll also mention, staff and our leaders met with legislators who serve on the Select Committee on Pension Policy. That's where we put most of our focus during the interim. The Select Committee on Pension Policy is kind of the legislature's pension committee, but they're special in that they actually don't meet when the legislature's in session. They meet once a month when the legislature's not in session. And so we spent a lot of time during the interim sitting down with folks on that committee and advancing our priorities.
Yeah, and RPEC is unique in that we actually have a member who is on the Select Committee on Pension Policy, and she can vote, right?
Yeah, so the other thing that's special about the Select Committee on Pension Policy is that it doesn't just have legislators who serve on the committee. It also has stakeholders. And so there are two retiree representatives on there. One of them is our very own Bev Hermanson, who represents retirees and has served on the committee for quite a while now. And having her on the committee has really been a huge benefit to us because she can make motions, she can ask the committee to do things, and they listen to her because she's a committee member. And so the Select Committee really put together two of the bills that we advocated for during the session. The first being the one-time COLA bill, and they also put together a month of death bill. Now, what the month of death bill that they put together, which addresses the PEB month of death issue, it addressed the issue by ending pension prorating. And so essentially, no matter what day of the month a retiree passed away on, if this bill had passed, then the retiree would have received their full benefit for that month, and it wouldn't have interrupted DRS's pension payment process, and so retirees would have kept their health insurance when they passed away.
Yeah, and we'll get a little bit more into that one too. So each December, the governor prepares a budget request to the legislature. What was and what wasn't in Governor Inslee's budget?
Yeah, so we were a little surprised to see the governor's budget last year. And this budget comes out in December, and it's called the governor's budget, but really it's a request to the legislature. But having your priorities in the governor's budget is a huge, it's a huge advantage because it's kind of the default option, and the legislature kind of looks at it as a starting point. Now they're going to make a lot of changes to it, but having something funded in the governor's budget means it has the governor's support. So we were disappointed this year to see that the Plan 1 COLA bill, the one-time COLA bill, was not funded, and we were surprised too because Governor Inslee in all of his other budgets, in years where we've passed COLA bills in the other 4 years, did fund the COLAs in his budget. So we were a little surprised by that. But the governor did fund one of our other requests, and that was the PEB Medicare explicit subsidy issue. The $183 cap issue was addressed in the budget. And so essentially what the governor proposed in his budget was to raise the monthly cap from $183 to $193. And so that means for plans that were over the 50% premium subsidy limit, that they would get $10 additional support from the state, or up to $10 additional support. Now, there was another component to the governor's proposal to address this issue. He also had a bill introduced that would have changed the base subsidy rate from 50% to 60%. This would have been beneficial to retirees who were on plans that had not reached the $183 cap, but it would not have done anything for retirees who were over the $183 cap. And our primary concern when looking at this issue is if this $183 cap is not moved, then pretty soon all the plans are going to be up against the cap. No retirees are going to be getting 50% of their healthcare premiums covered by the state. So, while that was appreciated and would have been beneficial to some members, it didn't really address, it wasn't a long-term solution to the problem that, is most impacting our members.
Yeah, definitely. Especially as premiums continue to rise, the 193 only goes a certain way.
That's right.
Yeah. Okay. So back to the COLA, why do you think that the COLA wasn't funded this year? It wasn't in the budget?
Yeah, so that's a really good question. So this was a supplemental budget year for the legislatures. The legislature builds biennial budgets, meaning that in odd-numbered years, they pass larger budget packages, and then in even-numbered years, they make small changes to the two-year budget that was passed on an odd-numbered year. And so this was a supplemental year, so they were just making little tweaks to the budget that they passed in 2023. And so really, going into session, there was only about, I think, $1 billion of new revenue for the legislature to spend. So that's money that had come in over revenue projections that were forecasted when the 2023 budget was being built. This is, Governor Inslee's last year as governor, really, and this was his last legislative session as governor. And his governorship has really been about addressing climate issues in our state, improving the climate. And I think in his budget, we saw a lot of resources dedicated to continuing the work that he has been so dedicated to in addressing the climate. And so, I think, it showed that he was paying attention to us and he wanted to address one of our priorities. But we definitely wanted to see COLA in the budget. And so we were starting session at a little bit of a disadvantage. We had never before been able to pass a COLA bill in a year where it wasn't funded in the governor's budget.
Wow. Okay. I didn't know about that. That's crazy. Okay, cool. Well, thanks for teaching me and our members. So, I don't know, did you...
You sounded so surprised that I was telling you something that you didn't already know.
Well, no, I didn't know that last part, that, like, this was the only year that we had the COLA pass that wasn't actually in the budget.
I think that's true.
Yeah, I think, okay, to the best of your knowledge. So upon seeing that the COLA wasn't funded in the governor's budget, how did RPEC respond?
Yeah, so we scrambled to make appointments with the budget leaders in the House and the Senate as soon as we could, and we were able to meet with, leaders before session started. And, the way those meetings go, the revenue that appears to be available at the beginning of session is not the revenue that's going to be available at the end of session when they're actually making these budgets. And they can never make you promises. But we reiterated to them that this Plan 1 COLA was, really important this year, and what was funded in the governor's budget was not a substitute for the Plan 1 COLA. And, they were receptive to that message. But there's nothing they can do to reassure you at that point. So heading into session, we made appointments with, we reached out to legislators on all the budget committees, and I think we met about 20 of them or so, maybe more than that, as the session went along, especially in the first couple weeks of session. And we made sure that they understood that, this Plan 1 COLA issue wasn't the governor's budget, but we needed to see it funded this year.
So in these meetings, what were some of the things that you were hearing from legislators?
Yeah, so we were hearing a lot of support, especially from House Democrats. They seemed kind of the most gung-ho about this. In the Senate, we were hearing that the path forward might be a little bit uncertain, and it wasn't because they don't care about this issue, but I think they were a little bit more concerned about the revenue situation at that point. The House was, I think a little bit more positive in their perspective on the revenue situation in general. The other kind of wrinkle that we were facing is, so the two bills that came out of the Select Committee on Pension Policy, that would be the COLA bill and the month of death bill, didn't have Senate companion bills. So usually when we're working on a bill, it will have a companion bill that starts in the other chamber. So a House bill will have a Senate companion bill, and both of those bills are moving through their chambers at the same time, kind of in parallel. And that gives you options, because if a bill gets hung up in one chamber, then it can pass through the other chamber and then go over, and maybe there's time for things to be resolved and the climate changes a little bit. But we were operating only with House bills, and so we didn't have anything on either of those bills running in the Senate. And so that was a little, scary, especially when we were hearing positive things from the House, but we weren't sure about the Senate as much. Another thing that we were hearing, especially from budget leaders, is they wanted us to make it really clear to them what was most important to us in this session, which is kind of an unfortunate, situation to be in, because all of these issues are really important. But we were looking at kind of what was laid before us. We had this one-time COLA bill, and that had a substantial cost associated with it to the legislature, and we also had this increase to the PEV Medicare explicit subsidy that had two components. There was kind of the budget proviso that the governor had proposed, which would have been the increase from 183 to 193 on the cap, and then the bill that would have changed the base subsidy rate, which, in all honesty, was less important to us because it didn't address the longer term issue. So the raising the cap was very important to us, but what we were being offered was really a $10 increase. And so if we said, this is the more important thing to us, and that resulted in the COLA bill not passing, that would mean a lot of retirees would see their health care increase dramatically. They'd get $10 more support from the state, and they wouldn't get a COLA. At the same time, we were working behind the scenes with the Healthcare Authority and exploring changes that could be made to the benefit structure for Uniform Medical Plan Classic Medicare, which is the most popular and most expensive plan that's had its premiums go up dramatically. And that work is still ongoing today, but we, working with them, identified an option that looks like it's going to be able to save our members about $200 a month in premiums for UMP Classic Medicare. It's complicated, but it involves changing the drug formulary in the plan. And so knowing that work was going on at the same time, a $10 change to the base subsidy rate seemed less important than getting this COLA for our members, because, we felt, and we still feel, we're going to be able to deliver both of those things this year for our members. It was unfortunate, but we essentially were, we had to make it clear that this COLA is, restoring the retirement security for these PERS 1 and TERS 1 retirees was the most important issue to us in this session. I'm hopeful that, that we can get an ongoing COLA bill passed next session, and that is going to do so much to clear the deck for us, and we are going to be able to work on the PEV Medicare explicit subsidy issue. We are going to be able to work on so many other things that, because the Plan 1 COLA issue, we've had to fight for so long for it, and and getting this out of our way will make a huge difference for so many people and allow us to really expand our work. So in the second week of session, we saw the COLA bill, the month of death bill, and the governor's PEV Medicare explicit subsidy bill, which changed the base subsidy rate, all scheduled and received public hearings. And that was a really encouraging sign. It showed that the legislature wanted to listen to what we had to say about these bills, and we testified on all three of them. And the way things lined up, this all happened 1 week before our annual legislative day, which you had spent a lot of time in the last year organizing and planning for. What does our legislative day usually look like, and how did it end up looking in 2024?
So legislative day, we have that once a year, usually towards the end of January, maybe early in February. And the members will come out to Olympia, to the Capitol here, along with members from the Washington Education Association Retired, which is one of our partner organizations. That's WEAR for short. And what I do leading up to this is I reach out to all of the legislators, and I ask them for a meeting with however many constituents of our members who have registered. And these are 15-minute meetings where the constituents can speak with the legislators about our issues. So we will provide training to members ahead of time as far as good talking points and how to maximize, how to get the most out of that short 15-minute meeting with their legislators and communicate effectively in such a short amount of time. So all of that is organized by us. So this year was a little different in 2024. The event, we initially planned for it to be in person here in Olympia as we normally do. But unfortunately, the venue that hosts us and also hosts many other organizations that will come out here for their lobby day was bought out, from what I understand, and they closed. We got this news one day before the council office closed for the holidays. So we came back from the holidays and worked on finding somewhere else, but unfortunately with such short notice, it just wasn't available, especially with the amount of people that would need to be hosted and having that a sizable venue to be able to accommodate that. However, despite it being virtual, it did not diminish the value of the event. So it was still very effective. I found that legislators had more flexibility with their scheduling with it being virtual because we were able to hold the meetings throughout the entire week of January 22nd at that point. So there were benefits to it, and we had nearly 200 members collectively from RPEC and WEAR participate. And then we had 86 legislative meetings scheduled that and were held.
That's really impressive. And what was the message that our members carried to their legislators in those meetings?
So legislators were very familiar overall with RPEC. Many of them already have a relationship with our members. I hosted a meeting, and what I had observed was this legislator, he said, "Oh yeah, I already know you guys. Whenever I first ran for office, you all hosted me, and I remember you gave me cookies at your chapter meeting." He's like, "I remember you guys." And he was very familiar with our priorities, including the Plan 1 COLA. And we saw that through many of the meetings. Several legislators were very familiar with this issue, and that is thanks to the work done by our members throughout the interim to maintain these relationships with their legislators and stay engaged with them, and our RPEC leaders as well. So that was very important.
One of the things that I have certainly learned, one of the many things I've learned from our members is that cookies are a very effective way of connecting with legislators.
That's actually what the legislator said. He was like, "Yeah, just give me cookies and we're good." Obviously, he was joking. But yeah, I mean, whatever works. So largely the message that our members carried to their legislators was for the Plan 1 COLA. So the members had this opportunity to share their personal story and how they have been affected, or how people that they care about have been affected by not having this Plan 1 COLA for such a long time. And we provided materials to them ahead of time, handouts that they could give to the legislators that were fact sheets about the Plan 1 COLA that included data. So that was also very effective. And the feedback that we had received was that the training and the materials given to them ahead of time really set them up for success in these meetings. So I'm flipping the table back on you and asking you questions. So the same week as Legislative Day, the House Appropriations Committee had advanced an amended version of the COLA bill, but the month of death bill and the governor's PEB Medicare explicit subsidy bills faltered. What happened?
Yeah, so that was a really interesting week of the session. So I don't think I've gotten into the specifics of the Plan 1 COLA bill yet, but the way that the bill came out of the Select Committee on Pension Policy was it was a one-time 3% COLA capped at $125 per month. Now, that $125 per month cap was the highest cap that we'd ever asked for on one of these COLA bills. The previous 2 years, we had passed bills that were capped at $110 per month. So the House Appropriations Committee moved the bill forward, but they also amended it to reduce the cap down to $110 per month, which was the same as the two previous bills that they passed. They were citing the fiscal environment, which at the time it was still uncertain how much revenue there was going to be. And so they were looking for ways to get our priorities through while also saving costs. So the bill to address the month of death issue was initially scheduled to be voted out of the Appropriations Committee on the same day as the COLA bill, but it was not moved forward. It wasn't voted on. It was taken off the calendar. And the same day that it was taken off the calendar, a new bill was introduced. So to recap, the PEB month of death bill would have addressed the issue of retirees losing their health insurance during their final month of life by ending pension prorating. This solution did have a cost associated with it. Essentially, employers would have had to make increased pension contributions for their employees, and this would be a cost that would continue on as long as the program was in place. And so the legislature, again, was looking for ways to save money. So this new bill that we saw filed to address the month of death issue, instead of ending pension prorating, it would waive health insurance premiums for retirees in the month that they pass away. So what that would mean is it doesn't matter if you're unable to pay your premium in your month of death because you don't need to pay it. And that will prevent retirees from losing their health insurance during their final month of life. And so the upside of this proposal is it doesn't have any cost for the legislature, and that really increased its odds of getting through the session. Now, at this point, our message on Legislative Day had been really all about the COLA, and it was clear at this point, that the legislature was not going to give us both. Now, the third bill that we had testified in support of was the bill to address the PEB base subsidy rate, to raise it from 50% to 60%. And this bill, we'd been clear on Legislative Day that the COLA was the most important priority to us. And so this was the last kind of movement that we saw the bill make, and it unfortunately didn't advance any further in this session. And we're hoping that this is an issue that we can pick back up in a future session.
So, okay, the explicit subsidy, raising it from 183 to 193, was that separate from the 50% to 60%? Or was that part of the same?
Yeah, so they both were proposed in the governor's budget, but structurally they are two different issues. So the base subsidy rate, a bill was introduced to raise that from 50% to 60%. The $183 cap, raising that from $183 to $193, is something that appears in the budget. And so it is one component of the budget bill which the legislature wouldn't begin to really work on, or at least make public for a few weeks at this point. And so they are separate issues. We were hopeful that maybe there would still be room to adjust the $183 subsidy cap, which had been our request moving into session. But it wouldn't become clear if that would be in the budget or not for a few more weeks.
So the House was advancing the COLA bill and the month of death bill, but what was the Senate up to?
Yeah, so as I mentioned previously, the Senate did not have companion versions of the COLA bill or the month of death bill introduced. Right before one of the big cutoffs in session where all the bills need to be through their committees or they're dead, 1 or 2 days before that deadline, we saw a bill get introduced in the Senate that kind of bundled a number of different issues together in a way that you don't usually see outside of the budget bills. So this bill addressed a one-time COLA. It provided the same COLA that the House was working on that came from the Select Committee. It also bundled in another bill that we were, supporting, which was just a technical fix to the statute pertaining to the PEB Medicare explicit subsidy. Kind of clarified that the way that the law is currently being interpreted is its correct interpretation. And it also added a third thing, which we were not very wild about seeing, which would have forced a change to Uniform Medical Plan Classic Medicare to change there's a component called the Coordination of Benefits Savings Bank, and it would have essentially eliminated that portion of the plan, which would have reduced premiums overall, not very much, but it would have also decreased one portion of the benefit. And so at the same time, we were working with the healthcare authority on changes. We'd seen this as an option, as a potential change to the plan, but it was not nearly as beneficial to the change which we are supporting, which is changing the prescription drug formulary, which is going to change it's going to reduce premiums by about $200 per month. And so, we appreciated that the Senate wanted to address our COLA bill and get it through their chamber before cutoff. But we didn't love everything in the bill, and so we decided our position was other on that bill. Our president, Claire Olivers, testified and did a really great job of kind of articulating our position. But this was an issue, I think the bill was introduced on a Friday and had a hearing scheduled on Saturday morning. And so, we had to respond quickly to that. And that bill eventually, after we testified, it did not move forward. And that was okay because the Senate later had an opportunity to pass the bill that was coming over from the House.
Good. So ultimately, RPEC was successful in passing the Plan 1 COLA bill and the new month of death bill. What factors led to these bills passing? It really comes down to a couple things. First, our members did a really great job all through session of being advocates, contacting their legislators. Whenever our bills had hearings, we asked our members to sign in pro on them, and they did a really outstanding job of that. There were multiple times our bills had over 1,000 sign-ins, retirees showing their support. So we really appreciate everybody who took action in that way. In other sessions, things have gotten to a point where we've asked our members to write letters. We didn't even need to do that this session. We were hearing positive things. And the reason we were hearing positive things towards the second half of session, the revenue projections came out right before both chambers released their budgets. And these updated revenue projections essentially tell the legislature how much money they have to spend in a session. And they came in significantly higher than the previous revenue projections from a few months back. And so all of a sudden there was more money on the table, and we were hearing that, we were going to be able to get our COLA funded, and that the month of death bill too, which didn't have a cost associated with it, was also going to get through. What were some other bills that RPEC helped pass?
Yeah, so in addition to the COLA bill and the month of death bill, we, played a role in getting 4 other bills through that we were really excited about. So one of those bills, I kind of referenced it earlier, was that technical fix that clarified the statute pertaining to the PEB Medicare explicit subsidy. We were happy to see that pass and signed in support of that throughout session. And then there was another bill that has to do with protecting folks who need to use ground ambulatory services from out-of-network health costs. So if you are in a situation where you need an ambulance, you are probably not going to look into if that ambulance contracts with your health insurance and is going to be covered by them.
Yeah, it's an emergency. There's no time.
That's right. And so this bill essentially it passed, and it prevents balanced billing for ground ambulatory services, which means that that there's are limits to what these providers are able to charge health insurance companies and subscribers that they don't directly contract with. So we were happy to see that pass as well, and supported that as well. And then we also supported a bill that kind of expands and empowers the Healthcare Cost Transparency Board. This is a board that was set up a few years ago that really its goal is to look into the root of why healthcare costs are increasing so much. And so this bill added some new members to the board, including folks representing consumers. It also empowers the board to look into financial records of providers and look at how much profit companies are making. And so, this is really, I see the point of this board is to kind of identify who's making money, because, if costs are going up, somebody's making money. So look at who's making money and why and how much money they're making.
And take them down. Continue.
The bill also will allow the Health Cost Transparency Board to coordinate better with the Prescription Drug Affordability Board, which is another board that the state has set up to try to make healthcare more affordable for Washingtonians. And the final bill that I'll mention here is a bill that is not going to be something that directly impacts any of our members, but is really a step in the right direction toward getting Washingtonians prepared for retirement and allowing them to have their own retirement security, regardless of who their employers are. This is a bill that came at the request of State Treasurer Mike Pellicciati, who's really worked quite hard over the last year to identify an issue that is going to be facing our state very soon, that most current workers are not saving adequate amounts of money, or in many cases any money at all, for retirement. And so when these folks, when it's time for them to retire, when they have to retire, when they're unable to work anymore, they are going to need a lot of support from the federal government and from the state as well. And so this bill is looking to address that by creating the Washington Saves program. And the Washington Saves program is a automatic IRA program that essentially most employees in Washington State whose employers don't already offer a retirement savings plan or a pension plan of any sort are now going to be automatically enrolled in this program, where they're going to be contributing a portion of their earnings to a retirement savings plan that's going to be managed by the state. And employees can choose to opt out. They can also choose to change how much their salary is going in to this plan. But I think a lot of people don't understand the amount of money that needs to be saved to be able to retire someday. And our members are really fortunate to have worked for employers that had some of the best pension plans in the country, and some of the best funded pension plans in the country at this point. And unfortunately, fewer and fewer employers are offering adequate retirement plans for their employees. And we're hopeful that this is going to get more people thinking about the decisions that they need to make in preparation for retirement.
So what was included in the supplemental budget that the legislature passed this year?
So the budget included funding for a number of the bills that I just mentioned, including the Plan 1 COLA bill, the ground ambulatory bill, the healthcare cost board bill, and the Washington Saves program. And the most notable was the expenditure that went towards funding the COLA, which is a program that's funded over a 10-year period. There was also something included in the budget that we were a little concerned about. So in February, RPEC identified problematic language, the initial budget proposals that the House and Senate put together, and the Senate's version of the proposal stated that the legislature intended to merge Public Employees Benefits Board, or PEB, with the School Employees Benefits Board. or SEB. And while a PEB and SEB merger would not be inherently a negative thing, the proposed merger language that we first saw in the budget, it didn't come from public or school employee groups or from retiree groups. It didn't seek any input from stakeholders into this process. Also did not guarantee that retirees would continue to be represented on the combined boards like how we're currently represented on the Public Employees Benefits Board. And RPEC, we identified the language in the budget, and we helped kind of pull a coalition together of public employee unions and school employee unions who get their health insurance through PEB and SEB. And we sent a letter, or we signed on to a letter that one of our partner groups put together asking the legislature to remove or change what they had initially proposed in the budget. And so what we saw in the final budget was better than what had initially been proposed. The legislature's intent was stated. It wasn't just a study to look into this. It also said the legislature intends to do this. That language was gone. It was just a study. And some of the things that had been asked for in the letter were all addressed in the final language. And so that's a process that we will be absolutely monitoring moving forward to make sure that our benefits are not put at risk by this proposed change in the study.
So then, leading up to the next legislative session, we kind of talked about the legislative interim and how it's a cycle. But do you foresee anything unique for this interim? I mean, this is an election year. It's a big election year.
Yeah, you're absolutely right. This is going to be a huge election year. We have most of the state legislature up for election, as well as all of the statewide offices. And we also have a couple of open congressional races here too. And so the RPEC Political Action Committee is going to be working very hard to make sure we do everything we can to help elect pro-retiree candidates to public office here in Washington. And it's really key that the folks who are elected to represent us understand our issues. So the RPEC PAC is going to be getting involved in races, identifying new candidates who support our issues, help them get elected, as well as supporting incumbents who have done a great job for us in the past. We're also going to be working with the Select Committee on Pension Policy to get that ongoing COLA proposal moving forward. That work's going to start really soon, and we're excited about that. And we're going to do everything we can to make sure that we have the best possible proposal for retirees headed to the legislature. I'll also mention that there are a couple of initiatives on the ballot that could have consequences for our priorities if they do pass. Two of these initiatives kind of address the legislature's revenue sources and limit the ways the legislature can collect revenue. And so if the legislature is faced with trying to figure out how to make up revenue from lost revenue sources next year, it's going to make it awfully difficult, if not impossible, to get the ongoing COLA bill that we are going to be pushing for next year through the legislature. So that's another thing that we are keeping an eye on. So this is going to be a very exciting spring, summer, and fall.
That's right. And for members out there who maybe don't have this kind of experience, might feel intimidated of getting into this and getting involved, and that involvement and engagement is so important. So there are many opportunities for members to be educated on this process and on our priorities. They can attend the legislative committee meetings. Mm-hmm. The legislative committee meetings are open to all members, and we highly encourage you to attend those. We also, throughout the legislative interim, hold monthly legislative update calls. We also send out a weekly news flash every Friday, which contains updates as well, legislatively, both at state and federal levels. So there's a lot of resources for you that we provide to get you up to speed. So don't feel intimidated. The support is here. There are so many members here that have been doing this for a long time, and they are happy to help you to get involved. This sort of work is new to me, and Legislative Day, I had the honor actually of doing attending my first legislative meeting, which was not planned, but I essentially was hosting one of the Zoom meetings with a legislator, and the constituents, there was a scheduling conflict, so at the last moment they weren't able to attend, and I was on the spot a little bit, but I think I did a good job.
I overheard it, and you definitely did a good job. You
Thank
had
you.
your bill numbers right there.
Yep.
And yeah, it was a positive meeting, and the legislator told you he supports our priorities, right?
Oh yeah, he knew, he was already familiar with it, so that made things
Most
easier.
of them are.
And it was pretty casual. It was like, okay, that's cool. So yeah, you can do it. Anyone can do it. Well, Emmett, thank you so much for your time.
Thank you so much for having me on the show. Again, I've been a longtime listener, and it's really an honor to get to participate in the RPEC podcast.
Good. Thank you for tuning in to RPEC on Air. If you have any comments, questions, or feedback relating to the podcast, you can email podcast@rpecwa.org. Also, you can visit our website at www.rpecwa.org, view our publications, and you can view our legislative priorities document there. You can also visit our calendar for events that include the committee meetings, so you can get the information for the legislative committee meetings, among others. Those are held over Zoom, so no matter where you are, you can attend. If you do not have a computer, if you only have a phone, you can still attend those meetings. You're able to dial in as well. So, thank you everyone for tuning in, and we will talk to you next time. Bye. Bye, Emmett. Say goodbye to everybody.
Bye. Are we done?
I think so.